Hello, my name is Stephanie Tirado of Tirado College. Today I will be talking about speech impairments. In order to understand speech, we must first understand the communication process. Communication requires at least two people, a sender and a receiver. Communication also requires a message. It begins with the sender having a thought. That thought is then translated into a code that can be understood by the receiver. Speech is the vocal production of language. The sender may impair effective communication in two ways. One way is by creating speech sounds that are not produced correctly and therefore are not understandable. The other is the inability to produce the intended message because of difficulties with language. Today we will focus on difficulties with speech production. Understanding how our bodies work is helpful in understanding speech production. When we'd like to speak, our brain sends messages that activate other mechanisms in our body. The respiratory system includes the diaphragm, chest muscles, lungs, and throat. Its secondary job is to provide the air and pressure necessary for producing speech sounds. The vibrating system consists of the larynx and vocal folds. These vibrate to produce the sounds and pitch of speech. The resonating system consists of the oral and nasal cavities where speech sounds are formed. Speech mechanisms consist of the various parts of the body, such as the tongue, lips, teeth, mandible, and palate that are required for producing speech. Now we return to our discussion about communication. Remember, effective communication involves a sender and a receiver. It also requires a message. In order to understand the message, the receiver must understand the sounds of the words spoken by the sender. If the speech sounds are not produced correctly due to a speech impairment, the meaning of the message will not be understood. Speech impairments include three types of difficulties. Those difficulties include articulation problems, fluency problems, and voice problems. Articulation problems occur when the process of producing speech sounds is flawed. This results in speech sounds that are incorrect. It is important to note that articulation is related to the speaker's age, culture, and environment. There are four types of articulation errors: omission, substitution, distortion, and addition. Omission errors occur when a sound or a group of sounds is left out of a word. For example, rather than saying banana, one might say nana. Substitution errors occur when one sound is used for another. For example, one might say wabbit rather than rabbit. Distortion errors occur when a variation of the intended sound is produced in an unfamiliar manner. Addition error occurs when an extra sound is added to a sound that was already correctly produced. For example, rather than saying I miss her, one might say I misdid her. Fluency problems involve the rate and flow pattern of a person's speech. This usually involves hesitations or repetitions of parts of words, interrupting the flow of speech. Stuttering is an example of a fluency problem. Voice problems are the third and most rare type of speech impairment. Pitch and loudness are the two important qualities of voice. Pitch refers to the perceived high or low quality of voice. Loudness refers to the volume of voice. Impairments may be caused by brain damage, malfunction of the respiratory or speech mechanisms, and malformation of the articulators. Early identification and intervention is the best way to treat speech impairments. With therapy and sometimes the use of assistive technology, students are able to communicate effectively with their peers and teachers, thus closing the achievement gap between students with speech impairments and their typically developing peers. Thank you for listening. I hope you enjoyed the video.